Olá, pessoas. Sou Paula.
Hello, everyone. My name is Paula Mateus. We're going to talk about open health today. So, to start our panel, I'm going to ask everyone to introduce themselves and tell a little bit about their company and who you are and where you come from. So, welcome. Good morning, everyone. My name is Leandro Bissoli. I'm an attorney at law, specialized in digital law. I've been working for Peck Advogados for 18 years with information security and data governance management. Good morning, everyone. Good morning, Paula, and all my colleagues here at this panel. It's a pleasure to be here. My name is Thiago. I'm medical director of Med. We are a startup, and I'm a physician, radiologist. For more than 10 years, I have been working with technology in the health department. First in hospitals, Einstein and Sirio, Lebanese, implementing medical systems, especially diagnostic medicine equipment. I've also worked with open innovation, a little bit different dynamics with corporate innovation. And now I've been working on the entrepreneur front, and also I'm the medical director of the Paulista Radiology Society. I participate in SBs. I have a lot of activities with these regulatory entities that are related to the health segment. My name is Pedro Rabelo. Hi, everyone. I'm an engineer. Currently, I work with health and medical records online, which include the whole patient journey. So now we are part of the PSP group, and we are bringing to the market Ti.Saúde, which connects the patients to the entire journey from the beginning of the end of the chain. Good morning, everyone. My name is Pappini. I'm co-founder and CEO of Conecta Médico. It's a telemedicine platform. We serve health operators and also tele-pharmacies, and it's a B2C platform. Good morning, everyone. My name is Pedro. Thanks, everyone in attendance. I'm an entrepreneur in the health segment. I've started while I was still in college with our first company. It was a company called Vita. It was a medical record electronic files for small and medium practices. We started with any experience in 2015, and then we sold this company in 2020 to Stone. Augustus here in stage 2, and this was our first experience as entrepreneurs in this segment. And after 2017, we founded Mevo, which focuses on digitalizing the whole prescriptive process from end to end, all the way up to the customer experience and treatment. So we're focusing on the institutional market, and currently we serve approximately 13-14% of private hospitals in the country with our solution. And our goal is also to help the patients to have a better experience, have a better clinical outcome, and adhere to the treatment. That's it. Okay, good morning. It's a pleasure to be here with all of you. If you don't know me, my name is Paula Mateus. I'm a physician. I'm the leader of the Digital Innovation Committee, and I'm Innovation Director at AmorSaúde, which is one of our associates. So let's talk about open health. The first thing I always say, and I always bring everyone back to the ground, open health is something utopical. It's far away when you compare to other verticals of the economy, which include open banking and open finance. So let's get everyone on the same page. So if you don't know about open health a lot, first, we're still very far from achieving it. We really still have a long way to go, but talking about what's going on currently, I'm starting with you, Leandro, so that you bring a little bit of the concepts. Comparing to the other verticals, so if you don't know about the other verticals, the open systems, the open platform systems, we started with open banking. It was sharing of banking data between banking institutions. This evolved into open finance, which is now sharing with other financial institutions as well. We're talking about social security, brokers, fintechs, and so on, just to make it easier for the customer experience and the customer journey. So comparing open banking evolving to open finance, let's talk about the reality of open health. Well, Paula, you already brought the concept. The concept is sharing. So the holder is the patient. This is the person who starts all the actions regarding the sharing of his own data. In open finance and open banking, this started before 2020. There's strong actuation by Banco Central, which was the actuator, the regulator, because they were the orchestrators, and the open health system in itself, as mentioned by the Ministry of Health in the beginning of January, is the lack of communication between all the players that compose this open health system as a whole. And for the financial system, this was a little bit more clearer. Who were the players? And remember that the Brazilian financial system, since it was already digitalized since the beginning. Brazil is a reference in terms of digitalization of its financial market. It's a reference for the market in the United States and Europe as well. So now let's talk about open health. Great, but we have good initiatives by the Ministry of Health. Since 2020, they've been launching some decrees regarding policies and regarding the information systems and the creation of a health network. The challenges include lack of communication with all the players. If you don't ask everyone here how much you have contributed to this structure, there's no contribution, right? Nobody contributed anything. And in addition, the financial system is, in a way, it's structured. We're always thinking about figures, and we can look at balance to see if it's negative or positive, if it's everything's well structured. So this segment is already well structured. Regarding the health segment, with the practices in the clinics and hospital, there are some of them we don't have any digitalization. So how can we bring this open health structure to share all this data in this ecosystem without this environment? And then I'm going to return to you that the main point and one of the important points here is trust and security, safety. This is something that we need to discuss as well today. Yes, and talking about the financial system, which is digitalized in the health system, we have an entrepreneur here who created a company, a health company, and sold to Stone, one of the large financial companies in the country. And Pedro, how do you see open health with your previous experience in the financial market? Hello? Yeah. Well, I think that comparing open health with open finance and open banking as it started, the first initiative of the health segment was focusing on supplementary health, which is a little bit more related with what open banking was in the beginning, with the purpose of increasing competitiveness and increase information sharing. But since we don't have a technological base in the health segment, which is not an early adopter like the financial market, so this increases the challenges. And the Ministry of Health itself, together with NS and together with the Ministry of Economy, if I'm not mistaken, they concluded that doing open health by focusing on increasing competitiveness to have better offers for the patients could end up leading to risk due to complementary health. So as I see it, this is what hindered it in the beginning. But I think there's another perspective from open health. There is interoperability. And the health case is different from the financial case, considering the market. And I agree with the security. There's no specific NPD regulation to give this legal security and to have this exchange of information between the health players. But what I see, and I think it's a good perspective for the future, is this interoperability that we can implement when we have these companies that work with data, they receive this information in a structured way, and to allow this patient to have a better experience, and you can create better services or improve the clinical outcome. I think this is the great positive thing that we need to start with. But there's responsibility with health data that is related to institutional structure, security, and specific regulation that is different from the financial market. So we can't do the same thing. both from the supplementary health and also the legal and institutional responsibility to handle this information. And I agree with the challenge that you just mentioned. I think we need coordination with like the central bank did. We need more addition to the technology and these pre-requirements so that we can start with this interoperability and then evolve into other services. All right, perfect. So I think everyone here understood that we're far from open health, but we need to take a step back. And I don't like to talk about micro cases, but there are some micro cases in their specific ecosystems, and we have 3 ecosystems here that have interoperability of data. I was talking to Pappini and Freddy. I'd like you to talk a little bit, and then TJ can end our discussion. So how are you working with this data interoperability within the ecosystem that you work with? You can start, Pappini. Yeah, well, about my case, the first thing we need to think about open health. So we have something very simple that patients may go to an appointment with us in our network, and then they have their medical records, and they can at any time enable these medical records within the platform so that the other physicians can follow them up. So this means that the patient has power over the data that they have inside an environment. They can share this with other service providers, our health professionals that are going to serve him. So Pedro's comment was really interesting regarding interoperability. We're integrated with pharmacies, so we have PBMs, we do authorization of the medication programs in real time in our platform with health operators, but these are APIs, so we can't confuse API with interoperability. APIs are a means of connection. And another challenge, I think, that we need to look at, which is the path that is, as an alternative for supplementary health, but we're talking about 23% of the population. We have a huge country, and how can integrate all of these other users? So this needs to be government action. And another thing that I have been following about this subject, Paula, that is very interesting, it seems like RP, because we had a lot of interoperability platforms, and now we're going to have the platform to integrate all of these platforms. So there's a lot of things for us to discuss and regarding security, but in practice, I think the big step is the patient culture. The patient must be aware that they own their own data, and they should be able to share this data with other professionals or other institutions or not. They have this power. So in pharmacy, if you go to a pharmacy today, to a drugstore, the first thing they ask you is their CPF, and this generates a lot of information, but this information the patient doesn't get a hold of this information. They need access to this information. The same way they ask information about their clinical appointments. If we generate this culture, the next step will be to integrate this with the public and private health managers. I think this is how we should do it.
Great. I just would like to add on what Papi has just spoke about it, is that we have 2 huge challenges for open health. First, the digitalization of the market. Most of the sector is not digitalized, so we have a lot of doctors who are actually doing like all their notes on paper. Sometimes you go like to the clinics, and even though they have a software, they still have a room full of papers, and all of those information should be in the service of the patients, but they're not digitalized. So I think that the first thing that we have to do is to, push this digitalization, And the other thing is the speed, the speed that we deal in the health segment is different from any other segment. So I think things are a little bit slower, even though like if you consider like in the health, you already had the ISB certifying, health softwares much before than any LGPD. So we have other societies that would give the incentives before the LGPD, but we know that the speed of those are a little bit different. So we as entrepreneurs, we want to get together and try to launch it tomorrow, but we know that it's very hard to have it done. But what we do on our company is that we believe that in order to break this chain, it's not the doctor, it's not the drugstore, it's the patient, from the moment that the patient is the main player, that the patient has, their own medical information. For example, he can say that, I went to 2018, I went to the orthopedist. In 2019, I went to the cardiologist. In a specific year, I received, the vaccination. So all of this information should be in power of the patient. So even if it was the doctor who input the data, the patient should have, all of this content available. So I think that this is the first step in order for us to achieve. First, put the patient in the game as the main player, and then the patients can, push the open health, so the sectors will be interconnected. So I'm very aligned with Fred's opinion, because open health, it's more like the end of a journey of how we can have the sector digitalized. So we are still partially digitalized. Here in São Paulo, we are just across the street from a very digitalized hospitals, but I can tell you other hospitals in this neighborhood that is still working on paperwork. And if you go to smaller places, smaller neighborhoods, we know that, this is not really happening, so we still have a long way to go. And there's also another layer, which is the interoperability. So the feeling that I have when we discuss open health, they're still talking about interop that comes after the digitalization process. But independently, if it's an incentive by regulation, as we had on the open finance, or if it's a market incentive because of new business models, or the patients actually putting the pressure, it will only happen if you have a driver. Now that I'm on the private sector side, so I can see from a different point of view. So we don't exchange data. Who do we don't exchange data with, and how, So the main discussion that we should have right at this moment is that we have to start talking between companies and public companies. So in each specific cases, we'll be doing it. There is no point of just sitting down and doing a huge open health plan, So let's agree in, having like a vaccination card, We should have it, Technology to do it is not that hard. So we had a great experience with the COVID vaccines, but what about all the other vaccines? And I think that it took us so long to reach to this point, where we actually, on this discussion, for example, in the United States, it took us so long that today the driver is the patient. How it started in the United States, they started with high-tech law about 15 years ago, and the main goal was digitalization. The government had incentives for health institutions to have everything digitalized, because the government knew that in about 10, 15 years, he would like to have this data available to do health management. So they started with reimbursement rules, so the market's a little bit different from our context, but within this context, if the structure was already ready, then we're talking about maybe 2005, 2006, 2010, when the patient empowerment movement came along, and then the patients came along and said, look, this is my data, I gotta have the control of it. But when patients started saying that they were the one who should have the control of the data, there was already a lot of interoperability, a lot of B2B between, health insurance companies. So the feeling that I have here in Brazil is that we're doing three things at once. We are still digitalizing. We are starting to have, data sharing cases, and we also have the patient saying, look, I'm the one who should be empowered of my data, with all the LGPD and all of the digital movement. So I think that the drivers are very positive. They make us look ahead of us. But in order to have this implemented, we gotta, think about it. Do we have systems for it? Great. Are the systems talking to each other? Do we have a case where we agree and both doctors and patients will have benefits from it? And then I think that slowly we can build the open health. Okay, I loved what you said, and now I'd like to invite us for a second round, especially because of the user's case. So, Fred, regarding the culture, our patients from the new generation will come with the digital culture in it, But the older patients, we won't be able to change their mindset. So we have to accept it, So I agree with you that cultural is a generation issue. So we, from like the ones that are like on 30, 40 years old, we're still like, carrying pen and paper. So it's cultural, So I think culture is related, it's age related. The digitalization should be, from top down, The government should come and say, that's it, everyone should have it digitalized. We should have it a regulation. If we don't have this regulation, we will not be able to step forward. How we can exchange data if we don't have this regulation going on? So let's imagine like an ideal world. So let's say everyone who's about like 15 years old, 20 years old, they are already well comfortable with the culture. We already have like all of the health system totally digitalized. So thinking about the use cases. So should we start, having like a vaccination card where everyone will like be exchanging data like what we had during the COVID? Or in a different example, for example, exams, lab exams, blood exams, creatinine exams, everything should be uploaded and everyone should have access, so we stop repeating a lot of, exams being redone. So putting back into the lab, any case that you think that we should talk about it, where we can actually start interoperating the data and do a self-regulation in a health system. I think those two things that you mentioned are excellent regarding two cases. If I'm not mistaken, currently in the Senate they are talking about the telemedicine, because we still have a huge challenge that we had on the finance, but we know we need to have all of the health professionals to adhere to this technology. And also, how do we go along, when we're talking about, all of the doctor and patient secrecy, So somehow, maybe the data from the patient is less secure on your drawer than actually on a system. So those points that you've mentioned are great, but we have to improve our culture. So I'd like to mention a case that happened because of an incident. So we had like a blackout on our health system right in the middle of the pandemic. The data share completely stopped. So this created a fiscalization demand. So they said, okay, let's, double check what the public sector has regarding the health. What kind of information do they have it? So 70% of the federal government institutions, and here, it's a huge number because they put a lot of mixed economy. There is either not existent or very, very, very low information data security. So we still a long way to go. So in order, to bring, the safety, to be able to audit, the digital platforms, and in order to do this pilot, we have to bring the whole society, the society itself, to self-regulate it and put it in a very participative way. Otherwise, only the big players, because of the concentrations that happens on these ecosystems, they will have a competitive advantage comparing to the other ones. And then, ISBIS is doing it, So, they've been talking about it for a long time, even before the NDS was born. Well, I used to work at the MC Diagnostic for a long period, So for me, the exam sharing data, it's the huge case, Thinking from the medical point of view, we as the medical, whenever you would get like the data from the patient, would look at the diagnostic exams results, the last time he was in, and all of the exams results. So I think that sharing the exams results between players, it should be a crime, let's put it that way, for us not to have it all implemented and centered. This will reduce cost, reduce timing from patients. Sometimes the patients, is wasting time online waiting to do an exam, but he already had done that exam in another hospital. But technically it's a little bit more complex. I used to work at DASA, and DASA created one app that would like pull all of the results together. But when we're talking about technically, it's a little bit more complicated. So that's why I like the vaccination case, because vaccines a little bit simpler, and then we have like the database with the vaccination data. So it's something that we can. So let's say that if I already had the translational data, which means that that patient have already done that specific exam or that specific teleconsultation, even if I don't have access to the result of it, of the content of that information, if I have the timeline from the patient's health, I think that's the first thing that we should do, That will open the doors for the second step. So let's say like the person will be able to open the app and say, look, now I have the history. And then even though if he can click there and the results don't come up, then the doctors will start ask, how come the results are not coming up? So I like to think about complex cases and how we can break them down, So I loved when you said that this has to come from the top down. I tend to agree with you, but if you look at the USA regulation, it came from top to down. But one side, it was saying you have to do it, but then on the other hand, they were giving incentives and also, funding. I think $3 or $4 billion to give incentives for those who be regulated first. So here in Brazil, I think that we are more used to receive penalties, So instead of having like incentives, because then the whole technical board of the company will be looking at, how to abide to the regulation instead of, developing new products. So we have really to have those incentives, to, financial support and things like that. So. Okay, I don't think we're even talking about like the early adopter regulation. We're talking about to have the sector digitalized, to bring, the UPS and say from now on, you have to be digitalized. I'm giving you this software, I'm certifying this and that. So you give all of the options. I'll give you financial support, but you have to do it. Okay, so put it in practice. So we are rediscussing, the SUS price table. So we created the new tables, and then we say you're only going to have access to the new price table if you are digitalized. So in the United States was similar to that. If you'd like to have the advantage of Medicare and Medicaid, great. If you don't send the interoperative data, then you're not going to have the new payment for it. Great. So we have to have all of the interest lines. Fred, one case, even though whether you're working with or the one that you believe that you can start with, in order to one day be able to have the open health. Well, I truly believe that the health future is not 100% digital, it's not 100% physical. We are talking about, a fusion future. So I believe that only through this model we'll be able to, have the whole population being served by it. There is no point of only like serving 22% of the population that is the population that has like health insurance plans. So independently of our social class, we all use the government health system. So I think that we have to operationalize differently journeys for the patients. And that's what I'd like to mention about, the drugstores, because currently we are seeing, like the going back, to the drugstore and doing like a COVID rapid test, to check my sugar blood levels. So it's a place very close to everyone's home, like right on the corner. And then when you go to a population, let's say someone who has diabetes or is elderly, they are used to going, to their health place. So the drugstore should be one of those health, physical places where the patients can go and check. and have access to those type of services. So when we start to have all of all connected, I can, for example, in the Viva-Saúde system, I can do like check the blood sugar levels or check the blood pressures, and then take this information to a cardiologist. So even if we're talking about the same network, we can deliver some value, a very important value, not only for the patient but also for the doctor, because the doctor will have like real-time information to see if the patient has like high blood pressure, and he was able to measure the blood pressure right at the corner of his house, and then his doctor, who's probably kilometers away, will have access to the information. So what I'm trying to say is that we have to interoperate it, but we have to interoperate different points, the drugstores talking to the lab, talking to the doctor, that it's either, having the patients right in front of him, or maybe it's a patient that is in a ship, so, or maybe someone who is very far away from you. So when we have all of those different coordinates in this constellation, we are able to have all of the systems communicating. So I think that the first step we are already taking, in the last 2 years from the pandemics onwards, when we bring all of those players to interoperate it among themselves. Okay, great. So I think this is fantastic. Pappini, would you like to mention anything about your case specifically? And then I would like to ask Pedro to be the last one. And I like you to be the last one because I really, really like your journey, Pedro. So you can quickly tell us a little bit about it later. So, well, I think that what we're doing is the market, it's what the marketing has been doing the last years, talking about microsystems, integrated with some partners. So I would just disagree a little bit with what those guys mentioned, I think they should come from the government. Like if we always will be organizing ourselves privately, we'll be talking about microsystems, We should recall that we already have DataSUS set for years now. And if you go into DataSUS, it integrated all of the informations that were done, So this is the next step. We know that if you download ConnectSUS, you'll have all of your vaccination information right there. The problem that we have with this app, for example, let's talk about a prescription, you're familiar with that, but let's say that the doctor gave the prescription on paper. This information will only be available in the public sector if he will go to the public drugstore, If he goes from the doctor straight to his next door pharmacy that is not integrated with the public sector, then the information will not get to the public data. So the SUS is ready for it. But, we have a lot of, barriers. So you have to define what are those barriers, what are the languages that we're talking with, So we already have a experience with DataSUS and supplementary health, which is like the financial that is, sent. So the ANS is sending the information and SUS charging from the health operator. So we're talking about interoperabilities, So I really liked what Victor and Marcos have mentioned. So we have to stop talking about a few things and see what's going on in practice, and bring those examples to our real world from the point of view of the patients having access to the data, from the manager, doesn't matter if it's from the public or from the private sector, because we know that here in Brazil, when talking about management, it has to go through SUS, and I have a very optimistic point of view, but I think that it's a public health topic that it has to go to the private because 30% of the market is from the supplementary health.
Well, Pappini, I love to talk to you, how you speak and your speech, but really, considering the percentage of the population, 77%, that uses the national health system, SUS, and 23 uses supplementary health. These alternative systems that are not regulated, with little expression in this segment, the position in the assessment, I agree with you. We should have some government actions. But what we're doing in micro and ecosystems are examples that we can bring to the government. Good example of what you've been doing. How are you interpreting the data and contributing to the patient experience? Well, still talking about public health before we go into the digital prescription experience. There's a common denominator here. We said basically the same thing. I agree with Thiago that the example in the United States is the best example because they really solved the problem there. I agree that we have different incentives and which sped it up, but it's a good example of a good public policy. And I think that this is a public policy case for everyone. The private sector agents need to be there contributing to have this good public policies. What the financial market showed it, and they contribute to the public policies, and then we need to deliver the services based on these public policies. But this is not always what happens. Sometimes we need to make things happen, and then we discuss that with the public sector. The digital prescription, for example, I think it's 2014, 2017, there was no regulation, and we purchased medicine at the drugstore for this medicine the same way. With a paper, you need to give a copy of this paper if it's a controlled medicine. So after the pandemic, which came, all the drugstores saying we need a system for delivering these medications by means of PDF files, because now we don't need the physical piece of paper there. So I think the pandemic sped it up. Otherwise, we wouldn't have the regulatory or technical base to do it. But from my perspective, that is more considering the prescription, when a patient goes to a hospital or to a primary medical unit, currently the digital prescription allows this patient to receive a set of structured information, which is the prescription for the medication that he wants, or any test or examination they need to do. And they are the owners of this information. And what the technology does in this case that is good for the consumer is it allows, no one here has their own pre-pandemic prescription history. You need to take a picture of that piece of paper, and I believe that you don't have, unless if you use some medications regularly, you might have it. But the great improvement of digital prescriptions is that less mistakes. It can follow up and trace the protocols, and also the patient receives this information in a more readable way, in an easier way to access it. And they have their own medical records to avoid incorrect prescriptions, because there's no such interoperability. And the third thing is the purchase experience. We've always needed to go to a drugstore physically, be there. I agree with Fred that this will be a physical and digital, but I believe that the pandemic helped us to see that from the digital transformation perspective in the health segment, it's possible for the consumers to be empowered by this electronic prescription and take the decision if they really want to go to the physical drugstore or receive the medication at home via delivery. I think that this is an easier way, and what we're focusing on, and the last 24 to 36 months, we're still able to implement, but only penetrates 10% of the population. So there's still a long way to a long pathway that we should still cover. But this is great. Both the case of Memed and Mevo, first you solve the big issue, which is to understand physicians' handwriting, right? That was a big transformation. I had a notebook here, and Thiago and myself were prohibited to use paper. I have to write everything down in on my phone. So we're gonna wrap up our panel here to respect the time that we have. So first of all, thanks everyone. It's a good idea for the public to understand what Hope and Health is, and everyone who is here. We don't know where we're going to arrive with this open health, but we're trying to work with micro cases to develop things, to bring something to the government, to see some action. So these cases that we have here on our panel, we have 4 companies that are really doing things and making things happen at different points of this journey with their own micro and macro ecosystems. I have Leandro, who loves to discuss regulation about it. He is really an expert about digital matters from a long time. He's now coming to the health market to help us here. And please feel free to make your final comments and to wrap up our panel. Well, I'd like first to thank everyone to be here at this event. I share with everyone, I agree with everyone. I think that we need public policies to really incentive this, but the private initiative is important as well, and we need to do as the central bank did, is to bring the players to contribute. I think that the patients are the center of this whole operation. I think this is clear for everyone. And what is interesting, like Pedro mentioned, and we see it happen, is once we have the technology to deliver this service, there's no point to come back. I mean, telemedicine, for example, they try to hold it, but there's no way. It's a point of no return. Thinking about the prescription in a piece of paper that no one can read, it's the past. It's not digital transformation, it's digital adoption. And these teams, all these people here, they bring this provocation for the regulators to understand, oh my God, we've been doing this for 100 years. We don't need to do it anymore. No, we don't. And I think this triggers, really stimulate innovation. Like you've seen now, there are several tests you don't need to go to the hospital. You can take this test at the drugstore. Again, I would like to thank, and I would like to share the microphone here. So one last thing that I would like to say, and I think nobody mentioned here, I agree that the patient must be the center, the focus, but you can't forget about the health professionals and the physicians. We empower the patients, but we need to think of the service providers and physicians as well. Of course, the patient is the owner of the data, and he knows how to share this data. But those who know what to do with this data are the health professionals, the physicians, the health institutions. At Manad, we have this vision. It's all for the greater good of the patient, but the physician is responsible for the greater good of the patient. So we need to call the patient to contribute, but the physicians as well. We need the service professionals as well. And when I say physician, I include nurses, dentists, and so on. That's my last message. I would like to thank Miji and the panel. And it's a great praise, this opportunity, and SP Business and the private initiative to be here today. Like Pedro mentioned, is the good public policy. We need to work together with these public policies, and someone will design these public policies. These are people, right? We need to work with them. Well, thanks. It's not hard to stay outside the field and try to make comments, right? Yes. First of all, I'd like to thank, and I'd like to say that we need these public policies. I agree 100% with that. We need the government to act on this. If you look abroad, this is something that's already happening in Portugal, for example. There's a data center that is working there, but also bring it a little bit to our roles. First, it's a pleasure to be here sitting next to these great innovators, but the private initiative needs to stimulate this in the end, because it's a little bit utopical to think about NDS and we'll be able to do everything, but I believe that this moment will arrive and we need to be in the forefront of this. If the pandemic came and stimulated telemedicine and electronic prescriptions, and I think without the pandemic we wouldn't have advanced so fast. I remember the first drugstores when they received the electronic prescription, they didn't know how to do it, but I think we are the great simulators of this segment, and we need to continue simulating it regardless of the government and public policies. So, real quick, we have 1 minute. I'd just like to thank Paula for leading this panel, our colleagues here for all the experiences we exchanged here today. And just real quick here, I have a 5-year-old kid and decided when he was born that I wanted to create his medical record. And today, after 5 years, I have his whole history, appointments, prescription. I'll tell the results in a few years, but I think this could be a great way to do it. Us as patients, as citizens, to demand this information that it's ours and share it in this ecosystem. This will make the sector more sustainable for the diagnostics and so on. So we have this role to play as citizens as well. And real quick, the first startup invested in 2014 wanted to have a personal medical records and they bankrupted. Too early. Yeah, I know another one that's almost bankrupted as well. So thanks everyone if you chose our panel here, panel 3. Thanks for sticking with us until the end. And my last message is what brings us together, the common denominator here is to do the best work possible for the physicians, for the patients, or the pharmacists as well. I think we all take care of a piece of this puzzle, and my commitment here as investor in the health segment is to do the best we can every day to improve the sector. And I think that if we do it, it's going to, at long term, we're going to have a lot of initiatives aside from our initiatives. Sometimes it takes a little bit more time, more bureaucratic, because there's a lot of responsibility involved. But we're going to break these obstacles and make it happen. Okay, so first, everyone, thanks for being here. There's nothing more important that you can do than contributing with your time and your knowledge. So thanks for sitting here and accepting to participate in this panel. Thank you for your time. Thank you for the audience who heard us. And now let's go clear the stage for our next panel. Thanks, everyone. Bye-bye.